Chapter number 1, the psoas muscle, page 1. Hi, my name is Gadi Kaufman. I am a certified neuromuscular therapist specializing in strain counter-strain technique, or positional release. This is my model Heather. We are going to demonstrate all of the releases in my book. We will begin with chapter number 1, the psoas muscle. The psoas muscle is the most common cause of lower back pain in our society, but it's located in the front of the body, not in the back. The psoas muscle is connected to the spine from the front and the side. It goes through the hip and eventually is attached to the leg. When this muscle is in spasm, usually the right side is worse than the left because most of us are right-handed and we use our right foot more while driving. The spasm will twist the spine to the left, side bend to the right, and then it will compress the thigh into the hip socket. This will send low back pain to one side or both and to the hips. This is called referred pain. When this muscle is in spasm, we feel the pain in the lower back, the hips, in the front of the thigh, and sometimes to the upper part of the thigh. The psoas muscle is on the side of the spine. From the front, it's connected from the spine all the way to the leg. There is a left and a right psoas. When the muscle is in spasm, it has the ability to send pain to the lower back, to the front of the hip, to the hips themselves, and sometimes down the leg and to the upper part of the thigh. Most importantly, it will rotate the right hip forward and down towards the feet, and it will throw off the gravity center, which then affects the whole muscular system in the body as a compensation mechanism. First, I'm going to show you how to find the muscle spasm, and then how to find the position which releases the spasm. Heather, put your finger on your belly button. Slide it 2 inches to the right, 1 inch up, and then poke deep 2 times. When you poke, don't keep the finger there. You are looking for tenderness, hardness, or resistance. From there, slide the finger down 2 inches. Then poke again, not more than twice. Choose which point is more tender. You want to release the point that is the most tender or hardest, or both. With this technique, we don't release the points, we release the whole muscle. So many times, when you release one point, it will cause the second point to disappear. But if not, you can use the same position to release the second point as well. So, which point was more tender? Up or down?
The one up.
So move your finger to the point up. Once you have found the spasm, keep a light touch. Don't keep pressing the point. The more you press, the more you keep exciting the nervous system, which makes the spasm worse. To use the positional release technique, use a foam block, a couch, or a big chair to support your legs. We are going to use a foam block. Place your legs up on the foam block, one leg at a time. Never move both legs at the same time. Heather, put up one leg and then the second. The height of the support should be at least the length of the thigh. The starting position is when the knees are at 90 degrees. So first, Heather, slide your upper body slightly towards the point. With this technique, we don't use left or right. Either way, you move the body part towards the point or away from the point, based on which side of the body the point is located. Now, slide your knees toward your head and gently drop your knees slightly toward the point. Once you are there, check again. Poke once, twice. Is it less tender, softer, or both?
Both.
We're looking for at least 60 to 70% less tender, softer, or both. Or just say it feels significantly less painful. Once you have found it, keep your finger there for 90 seconds with just a light touch. Let's say you did not find the correct position yet. It's like finding the right water temperature for the shower. You turn the knob back and forth to find exactly the right temperature. Let's say you're only at 50% better. Now we do what is called fine-tuning or adjusting. You're going to slide your knees toward your head, away from your head, or to the side or the center of the body. Every time you slide to a different position, poke and see if it's 60 to 70 degrees less tender, softer, or both. So for example, if you're not comfortable yet with the 50%, slide your knees slightly toward your head, then poke and let go. All you need to do is to poke and let go, and then to listen to the information from the finger. And then you might need to move the knees away from the head and poke, maybe toward the point or away from the point and poke. The information from the finger will lead you to the correct position of the release. It's not the finger that releases the spasm, it's the position. Use the finger to inspect and make sure you found the right position. So once you found the position of release, you stay there for 90 seconds with light touch. In these 90 seconds, the blood starts to circulate more effectively. The oxygen will get in and the lactic acid, which is the cause of the pain, leaves. After 90 seconds, you check it again. It could be even more than 60 to 70% because of increased circulation to the muscle. Now we need what is called quality check. We have to compare how the muscle feels before and after the release to be sure it was successfully executed. Slide your upper body back to the center. Take your legs off the block, one leg at a time. Then, straighten your legs because we found the spasm with straight legs. You test it again by poking the point. If it is still 60 to 70% less tender, softer, or both, the spasm was released. If not, you can do it again. It will not make it worse. You will learn to find the correct position by practicing this technique. With the psoas muscle, you always start with the right side and then move to the left, no matter where you feel the pain. We don't chase pain. Most of the time, the right hip is rotated forward and down towards the feet much more so than the left. The reason for this is that most of us are right-handed and we drive an automatic car, which causes us to overuse the psoas muscle in the right leg.